Hello, dear friends. Welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about pre-existing condition in medical billing or pre-existing condition in healthcare domain. Before that, if you are watching our video first time and if you are not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that turn on the notification icon so that you will get every our video as a notifications to your mobile. Okay guys, now we are discussing about pre-existing condition. By name we can understand that there is a pre-existing means we have already have that kind of condition. Here in this healthcare domain, this condition is nothing but medical condition. So here the definition is medical condition that started before health insurance went into effect. So here, for example, you are a patient, you have a diabetes, and you are taking a policy in this month. So at the time, your insurance agent will tell you that since you have a diabetes, as per as per our insurance policy, the diabetes pre-existing condition like waiting period is a 2 years. So at the time, though you are started your policy in this month and you are giving the premiums to the insurance and your policy is active, even though the insurance will not give any benefits to you for this kind of diabetes because there is a waiting period for pre-existing medical condition of diabetes for 2 years. Once you completed this 2 years from this month, at the time, insurance went into effect to pay the benefits to you or your doctor. So until this 2 years, your diabetes will not covered by the insurance. This is called pre-existing medical condition of, or generally we can call it like a pre-existing waiting period. So here the condition is nothing but your medical condition. Depends on severity or depends on diseases types, the pre-existing condition will be various, like it will be changes. For example, you have a high BP. For that kind of situation, insurance will give different kind of waiting period. So depends on the medical conditions, the waiting period will be also changes. We have to note this point. Okay guys, now we are discussing that for example, you have a diabetes and your pre-existing condition is 2 years, but you consulted doctor after 1 year. For example, you started a policy in this year, but you visited doctor after 1 year, but your pre-existing condition is a 2 years for the diabetes. And at the time what happened, your doctor will submit a claim to the insurance and at the time insurance will process your claim and they will deny stating that pre-existing conditions. And here given first point, any service related to this condition will be denied as a pre-existing condition by the insurance company. So and here patient knows or patient already given this kind of terms and conditions or instructions from the insurance agent or from the insurance company. So as per policy, the patient will get benefits or doctor will get benefits from the insurance company once he completed his pre-existing waiting period like 2 years for his diabetes. But now here clearly patient is submitted within the 1 year. So here whose mistake example here, that is not mistake, but the thing is that is the policy of the insurance. So insurance is telling that as per our insurance policy, as per your medical condition of the diabetes, we will cover after 2 years only once this policy started date. So yeah, our date of service, for example, and policy date of beginning is only 1 year done. So now, as a AR caller, for example, you are working as a AR caller, you should have to understand that. So patient is submitted within the time period. So that is what insurance is denied correctly, like pre-existing condition. And also, if you don't know what is pre-existing waiting period, and if you are unable to read that particular kind of patient documents, at the time as a AR caller, you can question to the insurance representative over the phone call like this: what is the waiting period of the patient for this medical condition as per your insurance policy guidelines is. Then insurance representative will tell generally there is a 1 year to 3 years, or 1 year, 2 year, or 3 years. The insurance representative will tell this is the, for example, 2 years is the waiting period. And you should have to analyze your claim that when we submitted the claim to insurance. So we have, if we are submitted within the pre-existing waiting period, the insurance will deny correctly only. At the time, what you will do, you should have to generally, as per our RCM, generally that is patient liability, because patient responsibility, because patient submitted within the pre-existing period. So the patient will should have to pay for that kind of claims. So because insurance will not give any benefits to the that kind of pre-existing, within the pre-existing medical conditions period of claims. So here we have to understand that pre-existing condition, if it is 2 years, after 2 years only insurance will start to paying the benefits to the medical claims. Or otherwise, sometimes what happen, insurance will deny stating that non-covered services. If there is any remark code available on a denied EOB, you can see that because of pre-existing conditions, the insurance will not giving any payments to the doctor. For example, there is no remark code, it is a denied non-cover. If you are calling to insurance for the denied clarification, insurance clearly telling that because of pre-existing conditions, this patient will not give any benefits to the this kind of medical claims. That is what we have to understand clearly, that if the claim is submitted within the pre-existing conditions, it will be denied from the insurances as a non-covered charges or pre-existing conditions not covered. Guys, here the most common examples of a pre-existing diseases I given are like example diabetes. For example, you are taking a policy during while you are taking policy, you already have a diabetes. At the time, insurance, for example, might they will give like a 2 years of waiting period or 3 years of a waiting period. And for example, while you are taking a policy, if you have a cancer also, they told that okay, they will tell that okay, this is the pre-existing waiting period for this kind of cancer disease. For example, you have a asthma, they will give pre-existing condition, I mean pre-existing waiting period for asthma is, for example, 3 years. And for example, while you're taking policy, you have a some kind of kidney diseases. For example, there are some kind of diseases like end stage renal diseases. For example, you should have to kidney, some chronic diseases, it's the severity is more on a that kind of kidneys. So at the time, the insurance based on that medical condition, they will give waiting period like maximum waiting period, like this is the 3 years waiting period. For example, you have a high BP, at the time that will be leads to your heart problem. So based on that, your heart checkups and that depends on that BP levels. So based on that kind of symptoms condition or symptoms or medical conditions, the insurance will be, for example, there is a severity is less, but you have a high BP. So but as per insurance conditions, they will give like 6 months or 1 year waiting period. So like that, based on the diseases, the pre-existing waiting period will be depends. So mostly it is a depends on a condition of that particular symptom or particular disease. So these are the most common examples of a pre-existing conditions while you are taking the insurance policies. So we should have to understand that if you are taking any insurance, health insurance from the insurance companies, these are the, if for example you have this kind of diseases, they will give the pre-existing conditions. Until you completed your pre-existing waiting period as per insurance policy guidelines, then only you will get a payments to your medical claims. Once you completed your pre-existing period, then insurance will give the payments. That we have to understand. This is the concept of pre-existing diseases. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. And again, thank you for watching and thank you for your time. Have a good health. Bye for now.